Hi, I'm Dr. Odulak from East Village Physical Medicine, and today we're going to talk about the knee. So this is a model of the knee. This is the kneecap, and this is the long bone that goes to your foot, and this is the long bone that goes up to your hip. And if this were on me, it would be like so. Now the knee functions like this. It just moves back and forth. Now when the knee has an injury or is damaged for whatever reason, the joints start to wear out. And I'm going to show you what that looks like on video. So I'm going to take this and turn it this way so you can see here there's the long bone going up, the long bone going up, down, and this is the cartilage of the knee. The knee movements, and I'll play the video, moves back and forth like that, and you can see it's gliding, it's nice and smooth. There's a lubricant in the knee that we all have. Now when the knee has a problem, the joint starts to get damaged. You see the red marks there, indicating inflammation, and that's going to be painful. And if you look at this part of the knee, the joint is smooth, but here you're starting to get what are called spurs. A lot of you have heard of heel spurs. Well, these are knee spurs, or bone spurs in the knee. Another name for them is osteophytes. These are painful, and when the joint moves back and forth on them, that's when you hear the cracking and popping. As the knee continues to wear improperly, like with increased exercise or increased weight, the knee compresses even more, and you can see it doesn't even look really nice. Whereas before the joint was nice and smooth, this looks all broken up. There's more spurs on this side and spurs here, and more spurs there. This all becomes rigid and stiff, and this is painful. As it continues on, we're going to see, taking the bone and turning it this way, you can see that the bony process here is damaged. So that's actually what we're bearing our weight on when the knee is damaged, and when you move the knee back and forth, these ground up bone particles here is what causes the pain. As the knee continues to wear and tear, the tissue gets worse and compresses even further. So you can see there's almost no joint spacing, and now things really look terrible. This person is in a lot of pain there. The space is narrowed and the cartilage is degrading rapidly. This is a very painful process, and it's progressive. So initially it doesn't hurt that much. It's only stiff going up and down stairs. And eventually you can see the knee actually jumping around and grinding. That's when you hear the popping and clicking, and that's when people sometimes say, it feels my knee, like my knee is gonna pop out. At this point, if it gets so severe, total knee replacement is often needed, but it doesn't work really well. So it's best to get treatment before the knee completely wears out.